Welcome back to Parent Financial. This is John.
This is Frank.
And today we're going to talk about Medicare.
Yes. Hey, Jonathan, I heard that Medicare season is starting soon. Could you tell us when the open enrollment starts?
Yes, open enrollment is every year starting October 15th and it goes to December 7th.
Okay. Well, what about the people who just turned 65? Can they enroll?
There's different rules for people that are just turning 65 and now qualify for their benefits. And so if you're just turning 65, you have 3 months prior to your 65th birthday to enroll, or 3 months after your 65th birthday to enroll. So you have that time range of 3 months before and 3 months after to enroll. So there's no need to rush to get it unless you're going to be not covered anymore. So you have that range to do that.
Well, now that we know when to enroll, let's go deep into moving parts in Medicare. Could you talk about these parts?
Yes. So Medicare is broken into different budgets, and we simply name them A, B, C, and D, right?
Okay.
So keep it very simple. Part A covers your inpatient hospital. So basically, just to very simply put it, if you need to go into the hospital, that's what Part A takes care of you for. Now, to qualify for Part A, you have to work 40 quarters, okay? 10 years in the system, 40 quarters paying into Social Security so that you can qualify for Part A. Otherwise, you have to pay a fee for the Part A. It's very expensive. I think it's like $400 something a month. So make sure you get your 40 quarters. Now, Part B covers your outpatient, or meaning that anything outside the hospital. So if you go to the doctor, your family doctor, you go to a specialist doctor, you go to a clinic, get some outpatient surgery, all those follow under Part B. In Part B, you have to pay a fee every month for it.
Okay.
Right? Every year it changes. Part B is very important, and you also have to make sure that you qualify to be on Part B as well.
Okay.
And then you have Part D. Let's skip to Part D real quick. Part D is your prescription drugs.
Okay.
So you have to have medicine. So Part D, you also have to pay for that too, right? And that's something that you have to enroll in. You don't have to have the qualification quarters for it, but you must enroll. Now, Part D, you have to make sure that you enroll on time as well. Because if you don't enroll on time, the government will penalize you, and the penalty is forever, right? So whatever your Part B premium is supposed to be, it goes up,
Wow.
until you enroll it. And same thing for your Part D, you could essentially pay a lot more for the rest of your life. So don't miss the date.
Wow.
Okay. Now, finally, Part C, also known as Medicare Advantage. And basically what that does is that the insurance companies now get involved, and they will take over and help you get your coverage, and they'll coordinate with the government for your Part A, B, and D. And you still pay the Part B premium, but now you work with the insurance companies, so you go by their networks, their doctors, their benefits. And sometimes the trade-off is what you get more benefits.
I see.
Right.
Okay. So Jonathan just talked about what they call the traditional Medicare, then he Medicare Advantage. My next question is that Medicare supplements, or something they call a Medigap. So could you tell me which option is better, whether it's Medigap or Medicare Advantage / Part C?
That's a great question, Frank. A lot of people ask this question, and to me, there's not a better way. It's just very simply, think about it, you have two paths that you have to walk when you go to Medicare, right? The first path is, hey, traditional Medicare plus Medicare supplement. And what supplement does is that it covers all your out-of-pockets. Because if you don't have it, let's just say on average, if you go to the doctor, the government will pay 80% and you cover everything else, right? And it's no ceiling, so it could be unlimited. So you have to have either Part C or you have to have the Medicare supplement to cap those expenses. Otherwise, you're going to pay out of pocket forever. The Medicare supplement, you have to pay monthly for that. And depending on the plan you choose, it could cost you extra money, like the same premium that you're paying for your Part B. So people may ask, well, John, why do I have to pay extra money for? Well, when you have Medicare supplement, just think of this. It's like your PPO insurance when you had at your old company. You can go to any doctor, any hospital, anywhere in the United States. You can use your insurance very freely. Freedom, right? You pay for freedom. Now on the other side is Medicare Advantage or Part C. is localized. So it's by your county where you live, by the state where you live, where the county where you live. And now you have restriction. You have to go by their network, by the insurance company network. You don't have to pay extra for this program. So people like it. On the Medicare supplement, it's kind of like going to the restaurant and you ordering a la carte, and you have to add on your Part D, your drugs, you have to buy it separately. So you have to buy the Part B, you have to buy the Part D, and then you buy the supplement. When you go to Medicare Advantage, they take care of everything for you. You don't have to pay extra for anything, right? But now you may have an out-of-pocket maximum per year. You may have to pay some deductibles, but you don't have to pay extra per month. So it's kind of like pay when I use, right? Instead of I pay first and then I don't have to pay anything. So it just really depends on your situation. Now, if you go on Medicare Advantage, they do try to incentivize you by giving you a lot of extra benefits. Some companies pay for your Part B. Some companies will give you like dental and vision for free, give you gym membership for free. They give you a lot of extra benefits that try to entice you to say, hey, if you're not going to travel around or you're not going to need to go to specific doctors, hey, you just use this program and we'll give you all these benefits. And most majority of people may not need to have all that freedom, right? So you can choose which one's better for you.
Okay, that's great information. What's new for 2024? What's a new thing for 2024 and moving forward?
To make it easy, we would just talk about traditional Medicare, what the changes are. Part B, it's increased to $174.80 from last year, which is about a $10 a month increase. So you just have to expect a slight increase, due to inflation and cost of living going up. But Part D, if you are paying for your Part D, it's gone down about $1. So you're saving a little bit of money right there. Now, if you are on like a Medicare supplement plan and you're on a Medicare Advantage Part C plan, the changes vary by company, right? So you have to make sure you talk to your advisor or your agent, or if you don't have one, talk to us to see what changes are happening in your plans. But if you're already on a plan, they're very good about reaching out to you and sending you a packet to let you know what the changes are for the new year.
That's great. Let's talk about the economy for a second, because you know how inflation is hurting people. What about people who are on Medicare but they have low income and low assets? Which options do they have?
Yes, if you don't have money and you don't have very much income to pay for your Medicare and your Part D, then what you could do is you can apply with the state to qualify yourself for they call Medicaid. Okay, so Medicaid does extend into retirement as well. And if you have low income, low assets, depending on the state program, you may qualify for that program, and they will pay for your Part Bs and they will pay for your Part D as well. Right? And if you go on to the Medicare Advantage program with the Medicaid, then they will enhance all your benefits. Okay. So if you have like a vision, dental benefit, they'll give you more money. Or if you have like an allowance to go shopping for prescription medication, they'll give you more money, right? So if you are on Medicaid, get with your agent, or even very simply call the state, and the state will guide you on how to qualify for that if you do qualify, and it doesn't hurt. You could have money and you spent all your money and you can qualify. It doesn't mean that you'll have to qualify at one time only. You can qualify at any time.
Okay. Well, that's great information. And ladies and gentlemen, that's Medicare in a nutshell for you. If you or anyone in the family that needs help reviewing your Medicare coverage, reach out to your agent or reach out to us. We will be happy to help. And thanks again for watching.
Thank you.